Hey everyone, it's Warren Weekman here, and I'm going to go through briefly how to access the case log system and how to enter in a new case for your third and fourth year rotations. So the easiest way to get to the case log site is by going to the MedEd homepage, which is www.meded.uci.edu. Go ahead and click on Medical Students here. Once you get to this new page, you're going to go scroll down to this area. It says Student Scheduling and Case Logs website. When you click on that, you may be prompted to enter in your UCI net ID and password, which is the same one that you use for your email. I do want to note that this is a very different system from the old one that used to be in Merlin. You may have heard references or have seen some old documentation that point you to the Merlin website to enter in your case logs. I want to remind you that this is the new system that you're going to be using. It is separate from Merlin. If you have any questions about how to get to the site, please feel free to contact me. There will also be a link through Merlin to get to here, but the new system, the easiest way and the most reliable way, is to go through the medical education website as I had just described. Now, when you first log into the site, it's going to default to the student scheduling website, which we'll go over at a later time, but it's very important to note that within the student scheduling website, you will see a link to the case logs right here. Go ahead and click on that, and you're going to have a couple of options to enter in a new case, as well as review your existing cases. As one of the administrators, I have some extra options here on the far right-hand side, but for you, new case and my cases will be the most important areas. Go ahead and click on new case. And when that screen loads up, you're going to enter in the patient, what day you encountered the patient right here, patient's initials, the clerkship that you're on. Now this list right here should be automatically generated from the rotation that you're assigned to. Please be very vigilant in checking that you are assigned to the correct rotation. If there are any problems with that, please contact your course coordinator and they will add you properly to this case log system. The location, so if you're on your internal medicine rotation, you may be at UCI or Long Beach or the VA. Please fill out the appropriate site. Your level of involvement, from observation to primary evaluator, all the way to lectures, discussions, small groups. Enter in the patient's age group here, their level of English fluency, and the patient's diagnoses. Now, patients can typically have more than one diagnosis, so it's very important to enter in the most appropriate two that you find on that patient. If your course has pre-assigned certain diagnoses that you're expected to see during your rotation, these will automatically be filled here under primary diagnosis. If they have not pre-assigned a certain diagnosis, this list will be blank. To show all available diagnoses, click on here, show all diagnoses, and you'll see a list of about 200 different options for which you can enter in regarding this patient. Same thing applies to the secondary diagnosis, and feel free to add any additional comments that you need there, and go ahead and click on Save when you are done. To review all the cases that you've entered so far, simply go to My Cases right here, choose the rotation, either all or the one that you're on, and you can get a full list or a simple tally of the cases that you had seen. On a related note, throughout the course of your rotation, you will be receiving email reminders that are automated through the system, reminding you to complete your case logs at the midpoint of the rotation as well as prior to the end of the rotation. It's very important that you fill out your encounters as they occur or as close to as they occur as possible, because this gives the course directors and course coordinators a very good overview of the kind of patients that you're seeing on your rotation. For example, if you're on OBGYN and you're seeing a large number of normal pregnancies but have not seen any high-risk pregnancies, this can be used to track the breadth of exposure that you're having on the rotation, and if needed, the rotation can be modified either through new patients, different cases in the OR that you observe, or even just more focused small group discussions to encounter cases that you may not have seen in the clinic or hospital or OR setting. This provides a much better system to give all the students a much rounder experience on the rotations, and simply by filling out these forms, it gives you a better opportunity and gives the faculty more chances to give you a better experience. So that about covers adding and accessing the student case log system. If you have any questions, my email address is below. The course coordinators and directors are all familiar with the system and can also answer any additional questions that you may have. Good luck. Thank you very much for your time. Goodbye.